Hello everybody and welcome to 5 on Friday, CEENTA's live question and answer session. Joining me today is Dr. Omar Punjabi, who practices in our South Park, Concord, and Matthews offices. Thank you very much for joining us, Dr. Punjabi.
Luke, thank you for having me.
It was my pleasure. Today, Dr. Punjabi will be answering questions about how diabetes and high blood pressure can affect your vision. Some of these questions were submitted by you through our Facebook page. Our first question is actually a twofer. How high can blood pressure get before it starts affecting vision, and what could it do to my eyes?
So blood pressure has multiple effects on the body, not just the eye. It can affect multiple organs like the kidneys, the brain, the heart. The eye is one of the organs that's affected significantly from blood pressure. There are two ways in which blood pressure can affect the eye. The most common is what we call chronic hypertension, where the blood pressure has been high for a long period of time. And that can affect blood vessels, and it can affect retinal function as well. The second way is blood pressure can affect the retina when it's acutely high, when it goes up significantly, like say if it's above 200 systolic or 110 or 120 diastolic, and that's when it can cause things like optic nerve swelling, it can cause bleeding, it can cause retinal swelling and macular edema. But the more common way is when someone comes in with high blood pressure and that causes retinal changes. What that does is it can lead to vascular attenuation. So the blood vessels in the retina, which are in the back of the eye, so if this is the front and that's the back of the eye, the blood vessels on the back of the eye are affected by blood pressure. And then the other thing is it can cause things like a stroke in the eye, it can cause bleeding, it can cause what we call cotton wool spots, where the retina starts getting these white spots in it. And the scary thing is, just like diabetes, high blood pressure can affect the eye without any symptoms. And so, oftentimes you may be diagnosed with high blood pressure when you go in for a routine eye exam, and it's important to let your eye doctor and your primary care doctor know about that.
Okay, great. Our next question is, I don't have high blood pressure, but my dad does. Does my eye doctor need to know?
It's always good to provide a good family history. Because oftentimes you may not have something, but if you have a family history of something, then you are more prone to getting that. So we tell patients to always inform us if they or if their family members have certain eye or health problems. The other thing is, if you have a family history of diabetes or high blood pressure, then you should have your siblings and your kids and your parents and everyone tested, because they are more likely to have the same thing.
Okay. Our third question is, if I start getting eye problems related to high blood pressure, can they be fixed?
Yes, so thankfully nowadays we have some very good treatments for multiple eye problems, including diseases of the retina. If it's hypertensive strokes in the eye, then a lot of times there's no treatment. But if it's something called a vein occlusion, where there's a blockage in the outflow of blood that can cause retinal swelling, we do have some excellent treatments in the form of medications or laser in the eye. The most important thing though, by far, is having good blood pressure control. So if you can get your blood pressure under to normal limits and work with your primary care doctor or a nephrologist or a specialist in high blood pressure, that has the highest chance of success, and oftentimes that can improve the vision and give a better prognosis in the long term. And that also has good effects on the rest of your organs like the kidney, heart, and brain.
Okay. Our next question is, I was just diagnosed with diabetes and I have to start seeing the eye doctor. Do I need to go more than once a year?
If you're diagnosed with diabetes, the first thing to do is to get a baseline eye exam with your ophthalmologist or optometrist, who can dilate your pupil and look in with some lenses or take some pictures to look at the retina. Because oftentimes you may have been diagnosed with diabetes, but you could have been diabetic for several years without knowing about it. And so, I usually tell patients it takes about 3 to 5 years to get signs of diabetic retinopathy, even though you may not have any symptoms. And so if we start finding changes in your retina, then that indicates that you're being diabetic for at least a few years. Now, if your eye doctor finds signs of diabetic retinopathy, it's classified into two stages. The less severe stage, which is the NPDR, or the non-proliferative diabetic retinopathy, or the more severe stage, which is the PDR, or the proliferative diabetic retinopathy. Now, your follow-up will depend on the stage of the diagnosis. So if you have no retinopathy, then your eye doctor will probably call you back to get a checkup once a year. But if you have mild to moderate diabetic retinopathy, it's probably every 6 months to 9 months. If it's the most severe NPDR or the PDR, then you probably need to come in much more often. And if you have any retinal swelling or bleeding, then you probably need treatment.
Okay. The last question is, I'm a little worried about everything diabetes might do to my health. How could it affect my vision, and what can I do to prevent it from happening?
That's a very good question. Diabetes can affect the eye in multiple ways. The most common way in which it affects the eye is it can cause a progression of your cataract, which is the lens in the eye, and that lens becomes more clouded with age. Now that thankfully has some very good treatments, and nowadays we have multiple surgeons who do an excellent job with a minimally invasive procedure, which is almost an in and out procedure and very quick and with good results. The other more severe type of problems that diabetes can cause is it can cause, like we talked about, retinal problems. And so if you do have retinopathy or retinal problems, then you probably will be referred to a retina specialist if it's gotten to a point where it needs treatment. And nowadays we do have very good treatments in the form of medicines, which either may be in the form of injections in the eye, or they could be sustained release implants which last in the eye longer. Or we also have some good treatments in the form of laser, where we can inactivate blood vessels or reduce the chance of bleeding in the retina. And the last option is, if none of these work, then we can actually do surgery to go in and either remove blood or remove scar tissue related to diabetes. But in the last 10 or 15 years, the prognosis for this disease has improved significantly, and a lot of patients have improvement in vision and not just stability in their vision.
Okay, great. That's all the time we have for today. We'd like to again thank Dr. Punjabi for joining us.
Thank you for having me.
Our pleasure. If we didn't get to your question, or you asked a question during the live session, we will be answering them in a follow-up blog on our website. Keep an eye on our social media for a link to that blog and for an announcement for our next 5 on Friday. If you'd like to make an appointment with Dr. Punjabi or any of our eye doctors, call 704-295-3000 or visit our website at wejustmakesense.com. Thanks for watching. We'll see you again soon.